Hi, welcome to Empowered PT with Dr. E. Today, I'm so excited to talk to you about grounding. Grounding is also known as earthing, and it is a therapeutic technique that involves doing activities that ground or electrically reconnect us to the earth. So, the idea is that in the 1970s, when shoe wearing became much more prevalent, we stopped connecting with the earth, meaning we stopped walking around barefoot as much. And unbeknownst to us, that walking around barefoot was actually an incredibly therapeutic technique to help to decrease inflammation in our body. So, when our body has inflammation, and this could be acute inflammation from an injury that you just sustained, or it could be chronic inflammation, such as chronic fatigue syndrome or neuromuscular diseases, things that have been going on a long time within our bodies. They emit a positive charge within our body. And so the idea of grounding is that when we connect either our bare feet or the palms of our bare hands to the earth, then we absorb negative ions from the earth, and those negative ions neutralize the positive ions created by the inflammation. So when we say connect to the earth, really what it means is that you can either lie on the grass, on the sand, in the mud if you choose. You can also just walk barefoot through the grass. You can sit in the grass with the palms of your hands or your bare feet directly on the grass. And you can also do this at the beach, and also submerging yourself, particularly in salt water at the beach, is also a really effective way of grounding. And it's why most of us probably feel better when we're at the beach, because between walking on the sand and getting in the salt water, our body is absorbing a ton of negative ions, and that helps to combat the inflammation in our bodies. So if you don't have a nice yard that you can go sit outside in and ground, there are various tools that you can use. And one of them is a grounding pad here. And the grounding pad will have a conductive side, and that's typically where the cord snaps on. And then it has a cord, and you plug this part of the cord right into the grounding portion of the outlet. So if I'm doing a Zoom call with clients, I almost always have my bare feet on this mat while I'm doing it. It's a great tool to use if you do have to work a long day and you don't have the chance to get outside. You can simply just put your bare feet right on the mat. You can also put the mat in your lap and put the palms of your hands on top of the mat. The idea is that you want skin contact directly on the mat, and that goes the same for when you're outside. Now, ideally, you want to try to ground for at least 30 minutes a day, but if you have chronic conditions, ground as much as you possibly can. And other tools that they sell are grounding sheets, grounding blankets, grounding pads for your mattress. My husband and I have a grounding pad on our mattress and grounding sheets. And studies have actually been shown that when people utilize the grounding sheets and the grounding mats, after 8 weeks, they have decreased anxiety, decreased depression, increased sleep hygiene, and they even reported overall decreased pain, whether it was osteoarthritis or other chronic inflammatory conditions. So this is a really helpful, easy, therapeutic technique that can help immediately to decrease inflammation. So specifically, grounding reduces or prevents the cardinal signs of inflammation. So let's say you sprain your ankle and you have redness or bruising and inflammation. If you can ground immediately, put your feet right in the grass or on a grounding pad. Studies have shown that immediately grounding, especially in that acute phase, can have a profound change in your symptoms. Personally, I've noticed that it has helped me with GI issues that I was having. I got my mom one. It's helped her with her knee osteoarthritis pain. Even have a client that said that he's been taking medication for his acid reflux since he was 12 years old, and since grounding he has been able to go off of his medication and has not been symptomatic. So it's pretty amazing how easy it is for us to help ourselves with the grounding, and it's something that isn't talked about enough, I think, in our day-to-day recovery and things that we can do to help ourselves combat that underlying inflammation. So typically most researchers will recommend that you ground at least 30 minutes a day. But if you have significant pain or a condition that's going on for a long time, ground as much as you possibly can. If you're watching TV, put your bare feet on that mat or your hands. If you have upper body pain or neck pain, put your hands on the grounding mat. And if it's more of a low back or lower body issue, then put your feet on it. So you can also put it directly on the low back, but because our hands and feet have the most cutaneous nerves, that's nerves on the skin surface, we absorb a lot through the hands and feet. And so that's the reasoning as to why they recommend planting your feet or your hands on the mat or in the grass or in the sand. But it can be an incredibly helpful way to reduce just a late onset muscle soreness after exercise, and both acute and chronic inflammatory conditions. It's been shown to help patients with MS and cardiovascular disease and Parkinson's, and those of us that have autoimmune diseases too, chronic fatigue syndrome, rheumatoid arthritis. So the author in the book that I read on earthing does stress, though, that if these conditions have been going on for a long time, be patient, and you might see changes right away, but you'll need to ground longer in order to really reap the benefits. Thanks again for being here. Take care. Bye-bye.